Hello, everybody, and welcome back. It's May of 2025. Excited, nice weather that we're starting to get out there. We are back here with our micros and macros
Yeah.
series. I am joined today by,
I'm Dr. Maggie Sopic.
yeah,
Yes.
of,
I own Recenter Chiropractic Wellness and Functional Medicine in Bollesburg.
that's why I let you say the title.
Thank you.
It's long.
I was going to, and then I was like, I don't know if
Yeah,
there's more meat to this. So.
sure. And I've got a really long practice name too. Dr. Emery Pitcel, Rothrock Chiropractic and Rehabilitation. We are here for our fourth installment of this podcast in May. And
Yeah.
today we're tackling a big one. This one is really important.
Yeah.
Both Maggie and I were talking before we got onto the call here about how excited we are because like this is just it's a biggie. It's one that we talk a lot about
Yeah.
to patients and a lot that we give recommendations on because it's a critical piece. And
Mm-hmm.
that is omega-3 fatty acid, better known as probably to most people as fish oil, right?
Mm-hmm.
That's kind of like the regular term that's kind of set out there,
Yeah.
correct? Without further delay, do you want to jump right into it?
Let's do it. Yeah.
All right. Let's start with a quick biochemistry here. And I don't want to go way too in depth because it could get really dull and it could get really deep and really
Yeah.
confusing. But what's really important to understand is that there's basically two major types of fatty acid chains that get digested into our system and become functional blocks for our performance and our body's metabolism and nerve function and heart function. And that's basically an omega-6 fatty acid and it's an omega-3 fatty acids. Now, both are what we call polyunsaturated fatty acids. This means that they have more than one double bond in their carbon chain. And what basically differentiates the big difference between a 3 and a 6 is where that first double bond exists. Um, on the one end of the tail, we get what's called a methyl, which basically just means it's a carbon, and then there's three hydrogens. It's basically like it's a glorified dead end. It's the cul-de-sac, right?
Mm-hmm.
Nothing goes further on because it's capped off by hydrogens. But if you go three carbons in, and that's where the first double bond lives, that's an omega-3. And if you have to go six carbons in to get to the double bond, that's an omega-6. It's kind of really that crazy and really that simple at the same time. And there's essentially a few different words, and I want to try to kind of clear up some of the vocabulary because probably Dr. Maggie and I are going to kind of be sort of slinging these terms around interchangeably as we go through. But pretty much the omega-3s, the three main kinds are like the alpha lipoic acid, which is ALA, there is EPA, and there's DHA. And for the sake of not wanting to fumble over myself like a fool, I'm not even going to bother to like pronounce what they are. They're very long titles.
Yeah.
But most people, if you're talking to a practitioner, they're just going to say EPA, DHA.
Mm-hmm.
If you go to like Sam's Club and you pick up the fish oil supplement and you look at the back and the parts, it's just going to say EPA and DHA anyway too, because it's another one of those. It's just super long and confusing, right?
You're right.
And then the big omega-6 that we're going to talk about and reference really frequently is called arachidonic acid. So again, omega-3s, we're going to have ALA, EPA, and DHA. And then with the omega-6, it's going to be arachidonic acid.
Mm-hmm.
And then just as a final point on this, the omega-3s, they are essential. And when we say essential, what that basically means is your body doesn't really synthesize very much of it on its own. So essential means you have to basically intake it from your diet to have a significant enough to be healthy. There are other minerals and macros and micros that aren't essential where your body can synthesize. These are not one of them, right? So that's, I think, kind of about as deep as I want to go on the biochem. Do you think that sets a little bit of a nice base layer for everybody?
Yeah, I think so. I think this is like most conversations, we can really get into the weeds, but I think, that covers the bases, and we can, sharing some of that vocab will be helpful for paving some of these other conversations.
Okay.
Yeah.
Well, let's jump right into the next conversation on the big functions in the body with our omega-3 fatty acids. Take it away, Doc.
Okay. So there's like, what doesn't it do?
Okay. Start with that then.
We're going to start with, maybe the most commonly known is our cardiovascular health.
Yeah.
So omega-3s can be they are really important for managing triglycerides and also that HDL cholesterol.
Yes.
So it aids in the management of that. I'll kind of just leave it at that for right now. So it is really helpful for our cardiovascular health. I guess then moving a little bit forward with some of the other functions is inflammatory responses, which is I would say probably the main one.
It is, yeah.
um, and in turn our immune response.
Hmm.
So specifically too, because we're both manual therapists, we can really relate this to inflammatory arthritis, but also just the overall inflammation of our body. So we need these good fats to really manage and control how our response is, and if we have like basically an injury, whether that be psychological, physiological, we need these fats to manage that in a lot of these conversion mechanisms. Um, Also, so, kind of maybe backtracking a little bit with the biochemistry. So these fats make up a phospholipid bilayer of the cell membrane. You
Yes,
don't
there you
need to
go.
remember that, but for our purposes, it's good to know because these fats are very helpful for our nerves,
Hmm.
basically.
Hmm.
And so, in cases of um, our cognitive function, our mental and emotional well being, and our cell membrane structure. And so, specifically, DHA is high in neuronal cells, meaning our eyes, our
Hmm.
nerves.
Yep.
Also, interesting, sperm tissue. And I like to also make this connection with the nerve function, especially and the cognitive function when we're dealing with concussions. These are
Oh,
really,
yeah.
really important. One last little bit is because um, I see a lot of cases dealing with like hormonal conditions. We need omega 3s for so many hormonal functions, our thyroid, for estrogen, testosterone, progesterone. We need omega 3s.
Yeah, for
So
sure.
a lot of functions.
Yeah, absolutely. Yeah, another one of those areas, again, why we were excited to talk about in the
Yeah.
podcast is one thing ties in a lot of different areas. May I add just a little color
Yeah, I was gonna
commentary?
say, keep
Because I
going.
like a lot of the stuff that you said there.
Yeah.
But I'm actually going to go and I'm going to call you, I'm going to call myself, and I'm going to call everyone watching this video. We're a bunch of fatheads.
Yeah.
Don't take that as an insult. What do I mean by that? Your brain is actually 60% by weight, 60% fatty acids, right?
Hmm.
And lipids, right?
Hmm.
So we're fat heads. Most of our brain is fat. That is like the
Yep.
majority of the gray and the white matter, right?
Yep.
And then of all of those fatty and lipids, 35% of them are omega 3s. So that means if you do the math on that, about 20% of your overall brain mass is omega 3s. So if you're not doing a good enough job, like getting these ratios or like getting
Hmm.
enough of it, that's almost just like theorizing and saying, like, imagine like you're voluntarily taking away a fifth of your overall brain capacity.
Yeah.
Maybe that's harsh to put it that way, but like that's usually a good kind of wake up call
Yeah.
for people to be like, all right, you got my attention. I'm going to
Yeah.
listen to you about how important fish oil is now, right?
Right.
Um, yeah, and then just kind of with the heart, agree too. There's a lot of evidence that says it slows the rate of atherosclerosis. So that's the
Hmm.
plaque buildup in the arteries. You said reduces triglycerides. There's even some evidence that says it actually lowers the blood pressure itself just by like
Yeah.
controlling like contraction and heart rate at the heart. So like again, a lot of good stuff. Um, I love that you talked about phospholipid bilayer. Um, did you, by any chance, do you remember the pathway of how you go from like arachidonic acid into inflammatory mediators, or would you like me to talk about
I'm gonna
that?
have you talk about it. I can
Sure.
see the picture in my brain, but
Okay.
I'm gonna have let
Okay,
you have at
this
it.
is going to be a biochem thing, but I'll keep it short, I promise. So, actually, what happens a lot of times is when people are asked the very specific question of where does inflammation come from and where it starts, a lot
Hmm.
of people get the answer wrong because they'll maybe cite something like one of the enzymes of saying that, like, that is what causes it, but that's just part of the pathway. When you said the phospholipid bilayer and you said that DHA and EPA embed and make up a big part of that bilayer, that's the answer right there. Inflammation actually comes from the wall or the cell membrane of each and every single cell in your body.
Hmm.
So what happens is we've got this enzyme that's called phospholipase A2. What people maybe don't know it by name, but if you ever are given prednisone or the Medrol dose pack, so like a steroid medication, that is the enzyme that's being shut down to shut off your inflammation. So if you're like rheumatoid arthritis and they're like, hey, we're going to give you a prednisone to calm this down, your acute flare, that's the enzyme that's being shut down to shut down the inflammation. And then after that step, you then go into things like cyclooxygenase, which that's where like ibuprofen and Aleve and all your non-steroidal anti-inflammatories, the NSAIDs impact. But basically, it flows you down into pathways. And what we have is all these enzymes act the same on DHA and EPA as they act on, so those are the omega-3s, as they act on arachidonic acid, which is the omega-6. So the argument basically is this: the more DHA and EPA we could put in our cell membranes, the more we actually flow down inflammatory pathways to good anti-inflammatory end products like leukotriene 4s and thromboxane and prostaglandin. Scratch that, actually. That's the good pathway that takes you down to the leukotriene 5, so the 5 series and the 3 series and the 1 series for the prostaglandins and for the thromboxanes. But then the more we have arachidonic acid embedded in our cell membranes, the more we then slide into the pro-inflammatories, which that's where the prostaglandin 2s and thromboxane 2s are going to live in the leukotriene 4s, and those are just going to keep us more inflamed. And I don't know, do you hear people all the time, just out of curiosity, do you hear people all the time, since we're keeping this in a musculoskeletal related discussion too, they say like, oh, it's wear and tear, like especially if they're talking about degenerative arthritis, right?
Yes, I do.
Could I tell you actually what I prefer to say instead of wear and tear?
Yes.
And I picked this up. I'm going to actually give a shout out to Dr. Seaman, who was one of my professors when I was at National. Don't think of it as actually wear and tear. Think of it as wear and lack of repair.
Yep.
Because that's really actually what's happening. And because like wear and tear implies that that joint and that tendon and that muscle gets broken down and it's not capable of healing itself back.
Yep.
Your body is amazing, robust, and strong. It'll heal itself back. What's happening instead is that if you are too pro-inflammatory, you are not healing back the way that you're supposed to heal. So you're having the same amount of wear, but now you're not repairing back. So it's not a failure, because like wear and tear implies that it's a complete failure to repair at all.
Yep.
But what we're saying is you're capable of repairing. You just need to better control like the hose rate to make sure that you're in more of these anti-inflammatory pathways and less of these pro-inflammatory pathways. So you could have a better wear and the wear will still be the same, but the repair is capable of being so much better. And that is the ticket to getting like a lot of people better that are stuck in kind of chronic pain.
Yeah, absolutely. Thank you.
That was a long explanation, but
I think it's
very
super
passionate to take this one on today because it was important. You know?
Yeah, I think that's super important because it is such a common quote. And it's not, it sounds like a death sentence. Like once this whatever structure is like torn or I have a little bit of inflammation, I'm doomed. And you're not. We just have to put a little bit more, maybe different work than we were used to.
Yeah, exactly.
No, I appreciate you going through all of that, really.
Yeah.
Do we want to go through the deficiencies with
this? Let's jump into that. Please tackle it.
Yeah. Now, with deficiencies, I'm mostly going to talk about signs and symptoms and what we may expect. And one of those that, we've just went over is that lack of healing or like a slow recovery. And so, this could be even like with wound healing as well.
Yeah.
Even again on that topic, as far as like cartilage, skin, musculoskeletal repairs. Also, with the skin, we could notice dry, rough, brittle skin, nails, hair. On the immune side of things, because we'll kind of utilize this hand in hand with inflammation, is just frequent infections or colds.
Yeah, absolutely.
So we, again, want to bump up those omega-3s. I did mention, on the terms of our nervous system and obviously our structure of our brain, the one thing that I mentioned too is the retinal health for our retina. So you could experience dry eyes with a deficiency as well. Some other, things that I've mentioned too, as far as cardiovascular health, it could be elevated triglycerides, high blood pressure, low HDL. That could be or low omega-3s could be a contributing factor to those markers
Yeah.
specifically.
And just to interject just really
Yeah.
quick, I know a lot of people know this, but just to clarify, there's like the good cholesterol, the bad cholesterol. The HDL is the good one, and the LDL is the not so good one. So you want
Yeah.
higher HDLs, you want lower LDLs.
Yeah.
Just wanted to put that in there
Yeah.
really quick because I know that's the second time you mentioned that. So
Yes, thank you.
sorry
Yeah.
to interrupt.
No, you're good. You're good.
Yes, yes.
At one point too, I mentioned, our cognitive health also including our mental and emotional well-being. So
Yes.
signs and symptoms could also be some brain fog or anxiety or irritability.
Hmm.
Also, on the terms of like hormonal health, especially with women, you could experience menstrual irregularities, also menstrual cramps. Normally, if you're experiencing that, I do recommend omega-3s to aid in that process.
Yeah, yeah.
Yeah.
If I may, just this is a little bit of a personal story,
Yeah,
but
go for it.
I don't know how often you ever go out to get fast food. Sorry, fast food industry, but I'll sometimes find if I'm on the road and I'm busy, and it's just like, you know what, I need to be hitting this real quick. I need a burger, or I need to grab some pizza and stuff.
Hmm.
I feel like I go into like a brain funk after that. Like I all of a sudden like feel like a little sick in my gut, but then I also just feel like more tired than trying to drive.
Yep.
So that's why I've actually fallen a little bit more in love with like anytime we're driving back, if we could pick at least some of the better food options. Like,
Yeah. Yeah.
I promise they didn't pay me to say this, but like Panera Bread, for example,
Yeah.
like I'll at least feel so much better driving the rest of the way, like eating
Yeah.
something that's a little bit more clean and vegetable and fruit based than
Hmm.
something that's bread, heavy cheese,
Yeah.
grain
Fats and
fed
sugar.
meat, and
Yeah.
fats and sugars. Exactly. So again, that also just kind of ties into the deficiency and just like
Yeah.
a personal relation, right?
Yeah. Yeah. Absolutely.
Maybe you feel the same way there too, right?
Oh my gosh. Yeah.
Yeah,
Yeah. Definitely.
right. Now, do we have to be concerned at all, you think, about like toxicity and overdoing omega-3s then?
Um. So on that, not necessarily.
Right.
We'll kind of dive into the guidelines for how much. So one thing that I guess one little thing, because it obviously is a fat.
Yes.
I guess more so when we're talking about like fat digestion. So
Mhm.
if there's something going on where you're noticing maybe you are increasing the omega-3s and you're noticing some like GI irritability, or mostly, or some like irritation on the right side of your body,
Mhm.
it could be due to having a difficult time with absorbing fats, and maybe something a little bit more involved in the gallbladder and liver potentially.
Right.
Not that it's super concerning, but just to like keep that in mind. Maybe like, again, kind of going layer by layer.
Yeah. The only thing I maybe want to
Yeah.
interject a little bit just to kind of like layer on to like the concerns. So we're gonna go over this. I'm gonna let you take on in just
Yeah.
about 2 minutes, like the how much, and then you're gonna see most people aren't getting enough.
Yeah.
But we don't want like all things supplementation. You don't want to go and swing the gate so hard the other direction that
Right.
you create a bunch of gastrointestinal distress and create like a funky weird nerve response where you get yourself like all ramped up and
Yeah.
anxious because now you've gone too far the other way.
Yeah.
There are a little bit of documented concerns if you are going to like really go crazy on the supplements with the fish oil, to be very
Oh.
cautious with
Hmm.
that, because there are a lot of times with the fish oil that you could kind of get at the store, they're going to have vitamin A and vitamin D in there. So there are a little bit of concerns about like going too crazy and then
Yeah.
giving yourself like a hypervitaminosis A or D.
Yeah.
Again, for most people, that's probably not going to be a concern, but we'd just be remiss if we
Yeah.
didn't mention it. And then if you are getting your source, like a really good source, as we'll cover in a second here, is from fish,
Hmm.
there are concerns about mercury
Yeah.
contamination in fish. We'll highlight that again in a little bit.
Yeah.
But those are maybe the only two that I just want to put out there, is just slight precautionary things to just
Yeah.
be alert and don't be completely in the dark that may be. But I think I don't want to say all that stuff and then have people be deterred from trying to get their omega
Yeah.
3s up. The benefit way outweighs the risk here, but
Yeah.
there is still things to just at least be a little cautious and concerned about,
Of
and make
course.
sure that we don't go way overboard and say like, I'm going to give myself 100 grams a day. Like, don't do that, please.
Right. Yeah. There is such thing as too much of a good thing. So yeah.
Absolutely.
Yep.
Yeah. Perfect. How about we go into the how much and like what's our dosing and our
Yeah.
recommendations?
Yeah. So there is actually not like a specific, like, this is exactly like the recommended daily intake, because there are multiple like healthcare associations that have different guidelines, especially for different ages, different conditions, which
Yes.
is interesting that it's specific to omega-3s and not across the board.
Right.
That's interesting. But anyways, averagely, is that even averagely?
How about on average?
On average.
On average. There we go.
I would say, like, looking at all of the associations, around 4 grams of a mixture of DHA and EPA.
Yep.
For now, again, I wanted to like more so like pick on breastfeeding women and pregnant women, aiming for 2 to 3 grams. It was recommended 2 to 3 grams specifically of DHA.
Yeah. Right.
Yeah.
Yeah. All right. Awesome.
Yeah.
Awesome. And I pretty much have all the exact same numbers. I also think it's still because you kind of can't fully have an omega-3 conversation, as you could tell the way this has been framed with
Yeah.
you and I talking about it. We can't have a full omega-3 conversation without the juxtaposition with the omega-6s.
Thank you.
Right?
Yeah. Yep.
Yeah. So just to maybe color commentate on there is that an ideal target for people to reach is like maybe like a 4-to-1 ratio. 3-to-1, you're doing stellar. I don't think I know anyone that can like really eat like 2-to-1 to 1-to-1 to their
Yeah.
threes
Yeah.
to sixes. But did you think, I think you told me before you were looking up like some statistics before that actually say that like our average ratios are a certain amount, right?
Yeah, it's like 15 to 20 to 1.
Holy cow. Yeah.
Or yeah, like of omega-6 is like
15 parts omega-6.
Yeah, and to
So
1, which is
that's
that is the
mind-boggling.
typical Western diet.
Yeah, and then I mean you'll get people that have like, metabolic X syndrome where they're struggling with obesity, diabetes, and cardiovascular problems like
Mm-hmm.
blood pressure issues. Like sometimes those ratios, if they're tested out, they could be as high as like 70-to-1. And then it's just not that I'm trying to victim blame,
Right.
but you look at that situation, you see a profile like that and pro-inflammatory, and then you just sit there and you're like, no wonder why they're that sick, right? It's not
Mm-hmm.
a shock at that point.
Right. Yeah.
So ideally, again, 4-to-1. I think I picked that up from the American Heart Association. Like 4-to-1 is actually a reasonable, obtainable goal for some people without basically having to spend all day chewing on spinach, basically, right?
Yeah.
Yeah. So
yes.
yeah. So how about this? Where do we get a lot of our omega-3s? And I think this is a good way to steer this conversation, right?
Yeah.
And this is basically going to boil down to, X surprised everybody, but the general crux of it is going to be plants versus animal foods.
Yes.
It's kind of really that.
Yeah.
It's oversimplistic, but it's also kind of that simple at the same time. So like when we do a really good job with our fruits and our vegetables and our complex carbohydrate greens, so some of the best sources for omega-3s include seaweed, chia seeds, flaxseed and walnuts, kidney beans, certain soy foods, and like pumpkin seeds, right? Of course, it's called fish oil because fresh fish is a fantastic source of a lot of the omega-3 fatty acids. And then also too, and that the reason why I said it's basically animal versus plant, but it's not quite that simple, right?
Yeah.
Because if you do get a lot of your meats that are grass fed and they're actually kind of like out to pasture and they're kind of getting a lot more exercise and a lot more nutrients that way, then the profile of the meat that you'll get and consume will actually be less heavy on omega-6s and have a little bit more omega-3.
Right.
So kind of just like we eat a certain food and that becomes our cellular membrane, well, so does it for like the cow and the pig, right?
Yeah.
It shouldn't be a shock, right? Their metabolisms work similarly to ours. Wild game, and then like, eggs that are maybe coming from like a smaller farm.
Yep.
Definitely maybe trying to avoid getting a bunch of eggs that are maybe from like the CAFO operations where it's like chickens upon chickens and it's just a sad sight to see, right?
Right.
But the more of that stuff you can get and get away from things that are like the vegetable oils and the corn starches and like, coconut oils and palm oils and and really antibiotic laden meats, like the more you're going to put yourself on a more omega-3, and therefore like, leukotriene and thromboxane series 135 versus the series 2,4, which is very pro-inflammatory.
Right. Well, all to say too is we definitely need omega-6s, and
I'm glad you brought that up. Take that out,
yeah,
please.
and you did highlight this either at some point though too, but we do need omega-6s, and there is a conversion like throughout both of these omega-3s and 6s, and again, your body is smart, but it is all about a good balance with all of this. And so we do, because our society is like really high with the omega-6s, our job is to really highlight the importance of the omega-3s and how anti-inflammatory they are.
Yeah. And again, just to slightly add a little bit more color to kind of what you said there too, we don't want anyone to leave this podcast thinking, I got to cut every piece of omega-6 out of my diet. That's actually not a good way to go about it, because we highlighted a lot of the pros on the omega-3s, but like, you do need, inflammation is a dirty word, but the reality is you do need a certain amount of inflammation, because inflammation is what helps you fight off infection. Anytime you've had a hard day of work and you've used your muscle and you've loaded your bone, part of the regeneration and part of that wear and repair is you do actually need a certain amount of that productive inflammation to debride like the stuff that you broke down and move that out, so that way you can reheal things. So if you completely shut all of that off, you ironically will be sicker, like just as sick as if you basically go 70 parts of one of omega-6 to 1 part of omega-3 6. So like, it's kind of like this, like all things in life and all things in medicine, it really seems to be the bell curve. I always go back to the bell curve in practice because it's so true. You don't want to be like all shut off on omega-6, but you don't want to be completely swimming in a lake of omega-6. You got to be somewhere in that bell curve, and all these associations and NIHs and AHAs and stuff are saying 4 to 1. That's kind of the peak of the bell curve. So the closer we can get you to there, the better you're going to feel, the better you're going to heal, and it's our job to try to help you get there, right?
Yeah, right on. Yeah.
So I guess, speaking of jobs, solutions, right? How do you like to try to work with people to get them a little bit more on board on the right ratios and more of the correct amounts of omega-3s in their diet and in their lives?
Right. So you talked about some really great sources. And it, again, depends on what is their concern or what is the condition. And so it may be that we discuss like what food sources they can utilize and can feel approachable. And a lot of, I will say, like, I hate the term superfood, but honestly, a flaxseed is like I love that, especially for menstruating women and postmenopausal women. Super, super awesome. A lot of benefits with that. So that's like my one little, like, if I had to pick anything, it would be that. But of course, fish. Obviously, we live in central PA, so the quality can be a little bit challenging sometimes to get. It may be indicative of a short-term or, dependent on the condition, supplement. This is where I am very picky with a condition and reviewing the brand of supplement and the ratio of DHA and EPA.
Sure.
It is. I also read an article that fish oils are like one of the top supplements, like to buy, which is great. I would venture to say the quality of a lot of the supplements is not the best. And this is where we have to be an informed consumer and look at the bottle, and it may have a lot of fillers in it.
Absolutely.
And not the best amount and ratios of DHA and EPA.
If I may interject, one of the things that we talked about in our clinical nutritional biochem courses was the labels can be misleading. You could go to Sam's Club, you could pick up a bottle of fish oil, and you could be looking at the front of the bottle, and it'll tell you like it might say like 2.5 grams per supplement, but you got to flip over the back of the bottle and say, okay, that's 2.5 grams for the entire tablet. How much of that is EPA and DHA? So like, if you absolutely have to buy the one from Walgreens or from CVS or they don't have Walgreens around here.
It's okay.
Look at me, like,
Some other people.
look at me pegging myself as being somebody who lived in Chicago for 7 years there. CVS, there we go. CVS or Sam's Club or
Yeah.
Walmart, right? And you're like, I want to buy that one. Fair enough. Look at the back of the label, do the math, figure out how you get yourself to 2 to 3 grams per, right?
Yep.
Okay.
Yeah.
Okay. Anything else to add?
I guess a little bit because testing can sometimes be a question or something that I do in my office as far as like blood work.
I was gonna say I had a question regarding that,
Yeah,
so tell everybody, please.
yeah. So by all means, you can do an omega-6 omega-3 ratio. It's a blood panel or a blood test, and that's an option. There is another blood test that is like a omega panel, omega profile. It's not always my go-to be honest. Most of the time, their signs and symptoms can pave a lot of the way to determine if it's necessary, but also getting some feedback as far as that other lipid panel with the triglycerides and the HDL and our cholesterol.
Yeah.
Also looking at inflammatory markers, so
Yes.
that high sensitivity CRP, so there's a bunch of like inflammatory markers that are I say in my office a little bit more helpful to determine if supporting this omega-3 is indicative.
Very good.
Yeah.
Yeah, I like that in-depth approach, right? Solutions on the other side, as you heard me kind of chime in about like supplements, I agree. Little tough to get fish, and you get a lot of people that don't like fish. So it's like, you know what? Let's supplement. I am kind of like you. I know you can only tell people like so much, like, hey, we would rather you buy a supplement that's maybe a little bit more expensive, but we know the quality yield is like so much better,
Mm-hmm.
and they're not going to have all these fillers and everything. I didn't run this by you beforehand, so I hope I don't get shot down in flames here. But I know a lot of providers that really like the tuna omega-3 from like Standard Process or
Oh,
MediHerb.
okay. Yeah.
Are you kind of a fan of that one? Or?
Yeah. That's a good one.
Yep.
I like Nordic Naturals.
Oh yeah. Okay.
Or there's Metagenics, but yeah, I think just again being and Standard Process is a good brand in
It
general
is. Yeah.
and a good company.
Well,
So
because their supplements are a little bit more. It's more like the whole parts of food, which is
yep.
really the way your body's supposed to be taking in these nutrients. And instead of like refining it down to one thing, ramming that up, which is fine to get you out of the short term, but if you're talking about what's something I could take long term, that's eventually going to kind of knock some other ratios, and then you're going to be kind of stuck chasing your tail,
Yep.
right?
Yep.
Or that's at least the argument I hear when it comes to like picking wiser supplements.
Yeah.
And I think there's definitely truth to that.
Mm-hmm.
I also like to tie this back to, and this is something I say in office all the time. I don't know if this is something you say, but really there are 3 major types of pain that exist in the world. And one of them is pretty much never going to come into our office because it's thermal pain, right? So if the stove hurts to touch it, stop touching the stove, right? And then if it's a bad enough injury, you're going to the burn ward. You're not coming to a chiropractic or a functional medicine. So we're not going to see thermal injury and thermal pain. There is mechanical pain and there's chemical pain.
Mm-hmm.
And where the omega-3 discussion ties in is I kind of make the decision that if I'm working with you in office and I think you need more support with your omega-3s beyond the basic conversation, then I'm going to refer to Dr. Maggie and be like, you need help with her to restructure your diet and your thinking and your lifestyle so that way we can control this chemical pain. However, if after the chemical issue is gone and there still is like this trap pain or this lumbar pain or the sciatica that's not gone, and you've done such a stellar job like actually taking care of like your inflammatory and done a great job with your omega-3s, then we can be pretty darn confident it's a mechanical presentation of pain. And then that's where we're going to go to town with McKenzie method rehab and other rehab exercises, do the soft tissue work and do the adjustments, which are a lot of the things you do as well too. But you and I both know I'm maybe an ounce more passionate about that stuff than you.
Yep, that's fair.
Yeah. So I think that kind of wraps up our solution and our discussion here, right?
Yeah, I'd say so.
Anything else you'd like to interject? Or I feel pretty good about like we covered a huge swath. By all means, we didn't talk about everything, but
no, I mean we could spend forever on just this one.
We
on
could
every
be on this
topic.
we could be on this for 3 hours, and there
Yeah.
would still be pieces that we missed
Yeah.
and everything. But I think something right around 35-ish minutes, like we're at right now,
Yeah.
that's a good time to kind of wind this down.
Yeah.
So again, we are Macros and Micros.
Yeah.
Dr. Maggie Sopic, right?
Yep.
Of
Recenter Chiropractic, Wellness, and Functional Medicine.
I'm always going to let you just say it.
Thanks.
Rothrock Chiropractic and Rehabilitation. This is Dr. Emery Pitcel. She's in Boalsburg. I'm in State College. Either way, Center County resources, Center County in Central Pennsylvania resources. If you really found this enlightening, if it was a helpful conversation, if you learned something, go ahead and hit that thumbs up and like us. Drop some sort of comments if you think there's something we should discuss or divulge on. We're always receptive to what topic we should cover next month. So if anyone's got something that they really want to hear us talk about, like leave a message. Like we might cover it in the next month or two for you guys. And subscribe if you found this helpful. There's a lot more useful information. Our passion is to educate and inform, and that's why we enjoy sitting down and doing. This is already our 4th episode. We enjoy doing it because it's a passion of ours to empower the community, right?
Yeah, thank you. Yeah, absolutely.
Yeah. So from May of 2025 and our Macros and Micros, thank you so much for joining, everybody. We will talk to you at some point in June, okay?
Yeah. See ya.